Hello all, I'm Dr. Karthika from Department of Biomedical Engineering, SNS College of Technology, Coimbatore. In this video, we are going to discuss about a case study on exploring the impact of virtual reality on healthcare. Actually, we all know about virtual reality is revolutionizing healthcare by offering immersive experience that enhance patient care, diagnostic and therapeutic applications in biomedical field. And also VRS used for pain management and treating phobias, PTSD, and it is not only used for diagnostic and therapeutic applications, but it is also used for patient care, telemedicine, and medical education and training part. Our students are going to perform a case study activity on exploring the impact of virtual reality on healthcare. Shall we move on to the activity? Yes.
Welcome to our fascinating topic, the case study on virtual reality in medicines. Virtual reality is making a wave in various fields. Medical field is not an exception. Let's begin with the origin that in mid 20th century only it getting evolved. If we see means in 1960s, Sensorama, which is invented, which is a mechanical machine which consists of 3D videos, audios, and vibrations and etc., which gives an immersive experience, which is invented by Morton Heilig. And later in 1980s, the term virtual reality is get popularized by Jaron Lanier. He started a VPL research company. Then later it is the virtual reality getting evolving and revolutionizing, and which is more accessible and sophisticated to the peoples. Then let me see the cut-edging technology, which are like Apple Vision Pro and revolutionizing the medical patient care and medical therapy, medical treatments, and etc. Let's divine it.
So let's dive into the real life application of VR, specifically in patient care. So patient care is something would be a futuristic, and personalizing the patient data and giving a personalized care for patient is sufficient enough. So in that place or in that sector, VR plays a major role, where during a painful surgery like chemotherapy or any other painful process that the patient undergo, we use virtual reality to escape that reality, and it decreases the pain or sensation during the surgery or any kind of procedure, like as I earlier said, like chemotherapy. Earlier, doctors used to conduct open heart surgery, which used to be anesthetized. For example, some operations used to be conducted lively, which is they only give local anesthesia where the patient used to be conscious. For instance, you take brain surgery. Open brain surgery would be conducted where the patient used to be alive and only local anesthesia would be given. So patient has to be conscious enough so that they have to be engaged in some task. So doctors used to advise them to do any sort of activities without making a big movement. So patient used to play guitar or sing a song usually, which turns out to be risky. For in that place we can use VR, which would be a game changer. And not only in patient care, also in rehabilitation, where people or a patient can wear that VR and get their personalized training without any assistance. That would be in the patient care. Let's dive into the educational point of view in VR.
So further moving on, in the virtual reality has seen a significant growth not only in other fields, also in the education field. Traditionally, a medical student would learn from lectures, textbooks, and hands-on experience. But the virtual reality offers a unique and immersive way of learning through which a student can operate a virtual model in a virtual operating room. Not only that, devices like Ocular Vision and Apple Vision Pro gives a new perspective of 3D anatomical models, in which the surgeon provides and takes notes from the anatomical model, and he simulates new kinds of scenarios. This allows the students to learn from a risk-free environment and also make mistakes through which they can learn a lot without causing real-world consequences. Further moving on, the virtual art program from the Stanford allows the patient and medical students to have an immersive experience in the virtual art and gives a deeper understanding of how the art functions and the structure of the art. And this not only that, a medical student cannot encounter various scenarios in this training program, but the virtual reality breaks the barrier of this and gives new training academics and new programs which allows them to have more experience when he comes to the real life world, and this will provide and give a new outcome for the particular student in the further moving on period of his practice.
So another exciting applications of VR is in therapy and mental health care. So VR can be used to treat conditions like PTSD and anxiety disorder and fibrosis. So providing a patient to a virtual environmental that creates a shock and shocks of trauma which the therapist can treat the patient and work through their illness and treat safe and controlled treatment. So technologies like Apple Vision Pro with a high realistic stimulation will enhance the effectiveness of therapies. And another VR applications is cognitive behavioral therapy, in which the patient can use a virtual avatar to treat their social behavior and stressful mannerism. And VR, another image natural of VR, would provide enhanced effectiveness of therapies.
I would like to conclude this case study. So VR is opening up so many possibilities in healthcare. By opening up so many healthcare and healthcare facilities and medical training. So opening up so many possibilities in the sense we would have thought that in science fiction, but in reality we can see VR is making a significant impact on healthcare. And with the cutting edge technologies like Apple Pro, VR is making an effective possibilities in healthcare. And as technology is advancing, we can see that VR is making a effective role in healthcare by providing preoperative planning and telemedicine and so many healthcare facilities. So this VR is making a significant